Hello, class.
Hello.
Like you saw in our video, we are talking about stroke.
What video?
The video we're gonna show first. Or we already showed first.
Right. All right. So, cerebrovascular accidents, also known as,
Stroke.
and also known as,
CVA.
brain attack.
Oh, brain attack.
Yeah, it's brain attack. Strange, I know. So what it is. So it's damage to the brain cells due to oxygen deprivation, brought to you by thrombosis, which is a clot forming on site, or an embolism, which is a clot that travels elsewhere, or hemorrhaging, which is internal bleeding. It is the single most common central nervous system disorder. And
So the demographic, which we found for the Canada, about 740,800 Canadians, which are adults for the age 20 plus, live with the effects of a stroke. And that's equivalent to the population of New Brunswick. Whoa.
mind boggled.
Yeah. 1/4 of Canadians living with stroke are under the age of 65. Wow.
Wow.
Yeah, and stroke prevalence rises sharply after the age of 55.
So stroke is a medical emergency, and early action can reduce further complications. So the brain cells begin to die due to the oxygen deprivation, which causes what? And comes about either because of a blockage, which is a form of ischemic stroke, or because of bleeding, which is referred to a hemorrhage stroke. And so the amount of damage a stroke causes is determined primarily from the location and the number of neurons that are damaged from not receiving proper nutrients to the tissues. So motor damage can happen, and from strokes it could result to full or partial paralysis. Yes, of one side of the body, and this is called
Hemiparesis.
yes, for weakness, or hemiplegia for complete loss of function. The side of the body to the side of the brain, which is affected by the stroke. Aphasia could happen, which is the loss of language, so your communication skills, you lose that basically, or dysarthria, which is slurred speech. So you'll have difficulties articulating some words, and memory loss, or even a mild to severe personality change that could happen because of it. Or it could also affect sensory damage, and it may result into permanent numbness or tinglingness, or loss of vision. And depression is quite prevalent because after stroke you lose a lot of your daily activities or your skills. So although a person can have a genetic predisposition towards CVA, many factors that contribute to stroke are within a person's personal control in their lifestyle.
Yeah, so there's many factors for stroke. A first one would be a big one, high blood pressure or high blood tension, which is untreated hypertension, is the biggest single contribution factor to the risks of a stroke. Smoking, atherosclerosis, atrial fibrillation, high alcohol consumption, and drug use such as cocaine and meth.
All those hard drugs.
Diabetes that's untreated, also obesity, and a sedentary lifestyle. But risk factors that cannot be controlled are age, because like I said before, after the age of 55, stroke rises sharply and affects more women than men. Migraines, your race, family history, and if you've had a previous stroke. And Joe, I know you had a story you wanted to say.
Okay, I'm just going to keep it short and simple at this point. But my grandpa, he suffered from a stroke maybe a couple of years ago, and I just remember how difficult it was for him, but it was also very difficult for the family, for us. we're a big family, so there was always someone visiting him at the hospital. But the hardest part was the fact that every day you could tell that he was struggling to pick up things, struggling to talk to us, not being able to smile. And he, he's a very strong man and very independent, and he hates when people help him. So, so it was just hard to see him kind of bedridden for the time that he was there, and he was there for months, actually. And it was his left side of the body that was affected by the stroke. Goodness sakes, I'm getting all emotional here. So again, I'm just gonna keep it short. Thankfully, with the help of physiotherapist and occupational therapist, he was able to, regain some strength and regain some kind of independence. He's definitely not the same person that he was before the stroke, but he's managing well, and he's definitely a trooper in that sense.
Good.
Yeah.
So he's doing good.
Yeah,
Better?
he is.
Yeah.
Yeah, so much better.
Well, there's an easy way to recognize if you or someone you know is having a stroke, and it's
So it's face.
Yeah.
Yeah.
Is it drooping?
Is it?
I don't know. Arms.
Can they lift both sides up, or both arms up?
Speech.
Is it slurred, or is it kind of
Jumbled.
jumbled? Yeah.
And time.
Time. So time is very important. Call 911 if you see these symptoms.
And fast. And it's altogether, it's fast, and it's an easy way to remember your signs and symptoms. So
act fast because
the
the quicker you act,
the more the person you save. Also, we have treatment plans, which are medical and for massage for like us. But the treatment plan are broken down into 3 categories, which is prevention, acute care, and then long-term care. Prevention would be identifying people who are at high risk for a stroke and encouraging them to prevent these measures, such as exercise, diet change, take antiplatelets or like anticoagulants, drugs, or even surgery on your carotid artery. But for the acute, there's 2 different types. Like we have the acute ischemic, which you would take thrombolytic medications to melt the existing blood clot, or the acute hemorrhage would be working to relieve pressure in the brain as quickly as possible. And also long term, it's to relearn how to do basic tasks such as walking, speech, eating, self-care, and you would work with like a physio, your occupational therapist, and they would help you to relearn these activities of daily living again. And and how was your grandpa's rehab? He did good with that treatment?
Yeah, he definitely did well with that, and every week he went to this cute community thing where a bunch of people who suffered from stroke, they kind of met up, and then they did little tedious activities. But it's something that he definitely looked forward to, which was really nice, and it was a nice way to for him to be social, but at the same time it's a good way for him to kind of get out there and see other people who are suffering from the same thing that he is.
Yeah. So for massage therapy, we have our treatment plans, but like we have contraindications and risks factors, such as like they might have other cardiovascular things going on that we might know about, and and the threat of having another stroke, like we don't know, right?
We don't know.
Also addressing what drugs they're on. Just because the type of drugs they're on, we want to be careful over massage and adapt to what they need, or Right. Also, the benefits of the massage is, stretching the muscles and showing them some exercises, and building awareness that they may minimize unnecessary loss of function, along with helping their pain and other lingering challenges that come along with having a stroke. Yeah. So basically, you're giving them a relaxation massage.
And who doesn't want a full relaxation massage at this point, right?
Yeah. Well, and that just helps them with their pain and anxiety and just everything, all the good stuff.
Yeah, I agree. All right, high five.
There you go.
Done.
So if you have any questions, comments, or concerns,
Please visit the stroke website,
which is heartandstroke.ca, and they'll know more there, you know.
All right. Well, thank you very much for listening. Enjoy the rest of your
that's
day.
That's good.